Thanks very much, Mr. Speaker. Mr. Speaker, this government's response to a dire shortage of long-term care beds in this province is to pretend that people don't really need long-term care and to push private sector and private sector assisted or supportive living beds instead. But I have had reports that 30% of beds or more at the Sturgeon Hospital and as many as 200 beds a day at the Royal Alec are taken up with patients waiting for long-term care beds. To the Minister of Health, since hospitals can only move a person from acute or subacute care to a long-term care bed, why is the Minister only funding new assisted living care beds? Isn't the government the bed
Honourable
blocker?
Minister.
Mr. Speaker, that's partly true, but in fact people who are in acute care can also be moved to a transition bed, and that's why we have moved some people into transition beds. That's why in Edmonton, for example, we have about 71 more beds in acute care hospitals that are comprised of transition beds or medical assessment unit beds or some other types of beds such as the medical observation unit beds, so as to take some pressures off of emergency. And the transition beds
Thank you very much. Transition beds are limited time, and you've got those transition beds by closing something else. Now, wait times for ER in Red Deer is the highest in the province for regional hospitals. Will the minister order that the Valley Park Manor long-term care facility remain open to help seniors get off long-term care wait lists and open up hospital beds in Red Deer?
Yes. Mr. Speaker, the staff working at the Red Deer Regional Hospital are doing a fantastic job in emergency and elsewhere. We were just in touch with them through my office a few days ago, and I have to tell you that on certain days this month they've got it well settled. There were 0 emergency inpatients on a day or two of those past several days, and they're moving in the very right direction with the way that they're providing care there.
The honourable member.
Thank you. Again to the same minister. Given that the Minister of Health's continuing care strategy, page 12, states that the province will propose incentives for outside partnerships for construction of supportive living accommodations and therefore won't create any new additional long-term care beds. Why is the minister pretending that he is creating long-term care beds when he is not?
The honourable minister.
Mr. Speaker, in fact we are, and just to follow through, Extendicare Michener in Red Deer just created 280 beds, new beds, and that's an additional capacity of about 60 beds. And many of those 280 beds are long-term care new beds.